Hi everyone, I'm Ashley with Nine Health Fair, and we're doing our show Health Happens. We're on a quest to figure out where health is happening because we know health is happening everywhere, all around us, to each and every one of us, whether we like it or not, whether it's good or bad. And believe it or not, there's major health innovations that are happening right here in Colorado, and we want to give you some of that information today so that you're empowered to make those decisions when it comes to your own health journey. And today we're joined by Dr. Catherine Green. She's a sleep medicine expert with UC Health and the University of Colorado Hospital. Is that right?
That's right.
Did I get that right? Okay, perfect. So we're talking today about sleep apnea. What sounds like it may not be that serious of a condition, but it actually is. Is that right?
That's right. So obstructive sleep apnea basically is a problem with blockage in breathing. It happens at night when we fall asleep because our throat is just a tube of muscle. And so,
a tube of muscle.
and so when that muscle relaxes, just like the muscles of the rest of our body relax, some people can be prone to having events where their airway can narrow at night while they're sleeping.
Okay.
And that causes snoring, which is one of the main signs that people may know that they have sleep apnea or suspect that they have sleep apnea,
Okay.
but can actually cause more significant health concerns. The snoring is accompanied with pauses in breathing when your lungs actually aren't getting enough air, and that can cause dips in your oxygen at night and really disrupt your sleep quality.
Absolutely. So it's not just snoring, it's actually a quite serious condition. So if you're just joining us, we're talking today about sleep apnea. We'd love for you to join the conversation. If you suffer from sleep apnea, if you're wondering if you suffer from sleep apnea, we're going to dive into all of that, and Dr. Catherine Green is here to answer all of your questions. So join the conversation below in the comments, and we'd love to hear from you. So you talk to us about a little bit what is sleep apnea, and the number of people that have sleep apnea is actually pretty large, right?
Absolutely, and it's growing quickly,
And why is
particularly in
that?
the United States. You know, I suspect that it's really from a combination of two reasons. Number one, I think as a society and even as just our physicians are getting better at recognizing that this is a serious health problem.
Okay.
So, you know, generations ago, a lot of people said, oh yeah, my grandfather snored, I could hear him from across the house, but no one used to really pay attention to that problem as a more serious health concern. And so now we're doing a little bit better about screening for this and really understanding that this is a problem that has major effects on our health.
Absolutely.
Of course, the other reason is that being overweight is associated with sleep apnea. And so as our country's obesity problem increases, there are certainly a growing number of people that are probably having their sleep quality affected by weight gain.
Absolutely. Okay, so obesity is a major, it can be associated with sleep apnea. Are there other health problems that are associated with sleep apnea?
Yes, so you know, in general, sleep apnea we know actually has consequences globally on a lot of different health factors, but particularly we know that these pauses in breathing put an additional strain on your heart at night while you're sleeping. And so undiagnosed and untreated obstructive sleep apnea we now know is associated with things like high blood pressure and even down the road strokes and hypertension and cardiovascular disease.
So really important to know if you do suffer from sleep apnea, it's important to be diagnosed with it so you can begin treatment. Is that right?
Absolutely. So, you
tell
know,
us-
we know that this is really not a problem that people should ignore.
That's a great point. Do
Yeah.
not ignore this.
Yeah.
So if someone is seeing common symptoms of sleep apnea, is there a way that they can get tested for it?
Yeah, so actually testing for sleep apnea is very straightforward and has gotten easier in recent years.
Okay.
So the way that you get diagnosed for obstructive sleep apnea was something called a sleep study. Basically, it's a way for us to monitor your breathing and your oxygen level and a couple of different parameters while you're sleeping.
And when you say that, I picture there's like a laboratory.
Yeah.
And is that the case anymore?
So traditionally, the only way to be diagnosed with sleep apnea was by what we call an in-lab sleep study, which was done in the classic overnight sleep study.
Yes.
You know, you come in and someone hooks you up to a bunch of monitors and watches you sleep at night. That's still the most valid test that we have and still a test that's very commonly done. But we actually have the ability now to do home sleep testing as well. So if you think that you have sleep apnea and want to get tested, it's very likely that we may be able to give you a monitor that you wear at night. You have a typical night of sleep at home in your own bed, and we're able to monitor your snoring and your breathing and your oxygen and really get a pretty good sense of what's going on and be able to make that diagnosis.
Okay, so that monitor just captures all that information.
Correct.
Oh, wow.
Correct. So you
That's
go,
great.
you pick up the monitor from a sleep center. It's generally a test that's ordered by your primary care doctor or by a sleep medicine specialist. And you go and you pick up that monitor. You have your typical night of sleep sleep at home, but the monitor records some things that allows us to make that diagnosis and start getting you treated.
So really no excuses. It's kind of easy.
It's easier than it's ever been.
It's easier than it's ever been. It's probably going to get easier.
Absolutely.
Okay, cool.
Absolutely.
So that portion is the diagnosis.
Correct.
So when you realize, or when someone is diagnosed with sleep apnea, what's the next step then?
So, after we know that you have sleep apnea, then as I said, the problem is that, we really can't ignore this. And a lot of people say, okay, well, now I have this diagnosis, so what do I do?
Right. What's next?
The gold standard treatment for sleep apnea is something called a CPAP machine.
Okay.
It's something that a lot of people know and a lot of people have seen because it's pretty common. And so a lot of people in this country have one or know someone that uses one. Yeah. So a CPAP machine is basically a little mask that you wear at night while you sleep. Okay. It sits on your bed. It's about the size of the old alarm clocks that we all used before we had phones next to our bed. But it basically sits on your nightstand, and it provides air pressure that's under enough pressure that basically, if you think about that area of your throat that's collapsing, that causes those blockages in breathing, it gives you pressurized air that basically supports your throat from the inside. And so it's something that you wear every night while you sleep. And we know that it's very effective at treating sleep apnea, which is why it's our gold standard.
The gold standard of treatment. We have some good questions coming in.
Excellent.
Let's see. Alexandra wants to know, what about people who sleepwalk? Can you test people who sleepwalk for sleep apnea? Yeah,
so it's a really good question. Sleepwalking is a separate problem from sleep apnea, but actually they can be related. So if you have a history of sleepwalking, obstructive sleep apnea is something that can make what we call nighttime sleep behaviors, which are called parasomnias, more prevalent. So it is something that I do recommend getting tested for. In general, I would recommend seeing a sleep expert, seeing a sleep medicine doctor to talk about what's going on at night while you sleep. Always bring a witness, so if you have someone that watches you sleep, it's helpful. But really, ultimately, a sleep test can sometimes help to tease out those problems. Is this something that's just sleepwalking, or is there some degree of sleep apnea going on as well?
Okay, cool. We've got a question here from Michael. So he says that he hates the CPAP machine and he can't use it. He stops breathing all night long, according to his wife, so he does have that witness.
Yeah.
He falls asleep during the day all the time and he can't keep his eyes open. He knows it's gotten worse, but due to not being able to use that machine, what else can be done? And I think you might have the solution, which we're actually here to talk about today.
I do, and that's one of the main things we're here to talk about. So you said that was Michael. Michael is not alone. So the CPAP machine is the first and best thing that we try for sleep apnea. But ultimately, about 50% of people with sleep apnea have trouble sleeping with the machine. So you are not alone. And for those people, really, 10, 20, 30 years ago, we had no other good options. But I really think that's not true anymore. So I actually do, the majority of my practice is sleep surgery. And for those 50% of people that can't tolerate the CPAP machine, we have some really good alternative therapies which can be very effective at treating sleep apnea. One of the newest therapies, the newest surgery that is FDA approved in this country, is a device that's called Inspire. And Inspire is a nerve stimulator that is used specifically to treat obstructive sleep apnea. It's actually an implantable device that is placed surgically, and then at night patients have a remote control, and when they go to bed they're able to turn on this device, and while they're sleeping, rather than having the mask and the hose and fighting with that, no masks, no hoses, you turn on your device at night, and while you're sleeping the device senses your breathing and actually provides a stimulus to the nerve that controls the movement of your tongue. And pulls those muscles out of the way while you sleep, preventing them from blocking your breathing.
Can they feel that?
You can. So at night, actually, when you sleep, your tongue will move. So if you have a bed partner, they'll see you sticking out your tongue at them. But overall,
won't see the giant hose, and they won't.
That's exactly right, and they won't hear snoring, and they won't hear pauses in breathing. But the device, you can feel the stimulus. It's not a painful stimulus. It's sort of like a contraction of the fist. It does take some time to get used to, and we have a process after surgically implanting people that allows them to accommodate to that feeling without it disrupting their sleep quality.
Very cool. And I think it's been referred to as the pacemaker for the tongue. Is
Correct,
that right?
correct.
Okay, so kind of
So
gives some
it's,
perspective
you know,
to
it looks and feels similar to a pacemaker, and it uses technology that's similar to a pacemaker.
Very cool.
So it's a very good way to think about
And
it.
that's offered here in Colorado, is that right?
It is. So I am one of the very few surgeons in the area that's implanting at the University of Colorado Hospital.
Have you done, are a lot of people getting this?
Yes, there's a lot of
Okay.
interest. Like Michael, there
I
are a lot
bet,
of people who
yes,
are
of
looking for
course.
other options. And this is really an amazingly effective and life-changing solution for a lot of those people who have been
Yes.
struggling for a long time.
Absolutely.
Yeah.
Okay, great. And so who's a good candidate for this particular device?
So, you know, first and foremost, it's that getting that diagnosis of sleep
Okay.
apnea, figuring out, seeing a sleep medicine expert, and figuring out how severe your sleep apnea is, exactly what's going on during sleep. Really, this device is best for people who have moderate and severe sleep apnea.
Okay.
And there are some other qualifications that we talk about clinically. There are some weight classifications that the device has been shown to be most effective with. And so it's most effective for people who are not extremely overweight.
Okay.
And so that would be something, and that's something that we talk about when we come in. Sometimes if weight is a factor in your sleep apnea, then it's something that we work on weight loss first prior to moving forward with implantation.
Okay.
But ultimately, what we do is we evaluate the airway as a part of consideration for this device.
Okay.
So we look at where in the throat your collapse is happening and determine if anatomically this is something that will be helpful for you.
So it's really not something that you take lightly.
No,
You really
no.
have to-
This is, you know, it's certainly, you know, it's an implant in your body.
Absolutely.
And
It's a
so,
surgical
yeah, and so it
procedure.
is a surgical procedure. All surgeries come with risks, and so we like to make sure we do a very thorough evaluation prior to moving forward with that surgery to make sure that I'm confident that it's going to be something that's really going to help and alleviate the sleep apnea.
Excellent. And if you're just joining us, we're here with Dr. Catherine Green. She is a sleep medicine expert, and she's talking to us about a new device here in Colorado that is helping with sleep apnea. But sleep apnea, we have a question here about, can sleep apnea cause heart conditions? So let's go back to the basics.
Absolutely. So sleep apnea is actually one of the main contributors, now we know, to heart conditions. And so particularly important in people that have cardiac risk factors to begin with. Sleep apnea, these pauses in breathing that are happening, put an additional strain on the heart at night. And so your heart is having to work harder in response to these dips in your oxygen and to this breaking up of your sleep at night that's happening. And so it certainly has been very strongly associated with things like high blood pressure, but also with arrhythmias. So irregular heartbeats are more common in patients with obstructive sleep apnea. And if you're at risk for an irregular heart rate, then having untreated sleep apnea can make that more severe and more potentially life-threatening.
So it's one of those things that you want to catch it. You want to catch it, you want to
Absolutely,
treat it.
absolutely.
We have another question here, or more of a comment, but she's not obese, and she does have sleep apnea. So it's not always associated with obesity or heart conditions.
It's
or
not,
like
and I think that that was one of the misconceptions for a long time that left a lot of these people untreated. And that, I think, is one of the things that we've gotten better about recently, is recognizing that sleep apnea can really come in all shapes and sizes. So we used to think that sleep apnea was a disease that was only for middle-aged, overweight men. And that's just not true. So I have lots of patients with sleep apnea that are stick skinny and not sleeping well. And some of them went for a number of years with people telling them, oh, you don't have sleep apnea.
They're like, please help.
Yeah, but really, you know, if you're not feeling like your sleep quality is good, if you're waking up in the morning, you know, say you're doing all the right things, you're getting a good night of sleep, you're waking up 8 hours later and you're still feeling tired, or you're dragging yourself out of bed, or you're waking up a lot in the middle of the night and your husband or wife says, you know, wow, you're really snoring a lot. Those are things not to ignore.
Okay. I'm examining my own life right now. I'm thinking I snore a lot, but I'm also sleeping a little strange because I'm pregnant. But I'm thinking, what? Maybe I need to go get tested. So I might be making an appointment with you. You just
Could be.
never know.
Snoring and sleep apnea do increase during pregnancy.
Yeah,
so.
because I'm, you know, and everything's a little wacky. But I'm like,
Absolutely.
I better not ignore this. Because I have been known to snore a bit.
Yep.
My husband may attest to that.
Absolutely.
Yeah, and if you have any questions, please join our conversation. We'd love to hear from you. I'm having a little trouble looking at the questions here on this one, so I'm going to switch out real quick. But so then, do you ever get questions about just sleep in general? If you don't suffer from sleep apnea or any other condition like that, do you have any suggestions for people on how to improve their sleep quality just in general?
Sure. So our society is really bad at prioritizing sleep.
Absolutely.
You know, there's this, tough guy motto of, I'll push through, and, it's a badge of honor to get less sleep and power through the next day.
Yeah.
And, what we know from a health standpoint is really there are zero benefits to doing that, and that's not a badge of honor. We're really working hard to make sleep more of a priority, because we do know that not getting adequate sleep at night, whether that is the quantity of sleep or the quality of sleep that you get, really can affect your daytime performance.
Absolutely.
Reaction time is slower. Mental clarity and cognition and memory have been shown to be severely impacted by even just one night, of poor sleep quality. And so, skipping a night of sleep, there's been studies that have shown that reaction times are similar to after 4 drinks. And most of us wouldn't go to work after 4 drinks or drive a car. And so we know that those performance tasks, particularly with reaction time and quick thinking and judgment, are impaired by a loss of sleep. And so really making sleep a priority in your schedule is the first step that you can take. Trying to set a regular wake time every day and a regular bedtime that allows you to get, having a good routine that allows you to get 7 hours of sleep a night if possible.
7 hours.
7 hours is the goal for most adults. Absolutely. And, in order to help yourself fall asleep and stay in good quality sleep, setting up a bedtime routine that's really good for you. And that can be tailored a little bit. Most of us, our body does better if we sleep in a cave. So think cold and dark.
That sounds appealing.
So yeah, a cool room somewhere around, 62, 64 degrees is really the most comfortable. Making sure that your room is dark and doesn't have a lot of ambient light coming in. And particularly getting rid of the electronics within about an hour of bedtime.
That's tough.
It's tough. It's tough for all of us to do. It's hard to turn off that 24-hour society. But the blue light, the light that's actually emitted from phones and iPads and computer screens, actually is one of the main signals to your brain to stay awake. And
so you're sending it the wrong message.
You are sending it the wrong message. And so really allowing yourself to shut off those signals at night and allow the hormones that are naturally building up in your body to help you fall asleep really can help long term with setting up that successful sleep routine.
And so if you need a little, entertainment or whatever before bed, you can still read a book, right?
Exactly. Quiet activities, reading a book, spending time with family.
And maybe talking to
winding down. Exactly. Taking a warm bath, having sort of time to yourself before bed. Those are all going to be activities that are going to help promote good sleep, both help you fall asleep and actually help you stay asleep throughout the night.
Because sure, it would be nice if we could all have like an hour-long ritual, right? But
Sure.
15 minutes will do, right?
Yeah,
Just
absolutely. Even just, setting aside, it's about setting aside that time. I really think it's about intentionality. So if you have 15 minutes, take the 15 minutes and really set yourself up for success.
Okay, that sounds great. Well, thank you so much, Dr. Catherine Green, for being here with us today.
Thank you for having me.
About sleep apnea. We'll continue to monitor these questions. So if you have any other things you want to talk about, sleep apnea, sleep in general, we will monitor these and make sure we get an answer to you. Thanks for joining us. Have a great day.